Welcome to the fifth video of this training. We will be talking about restorative sleep as another pillar of health in lifestyle medicine. Following the same format, we will talk about why restorative sleep is essential, define what it is, and give you some helpful tips on how to get more restorative sleep. We will start out with why restorative sleep is essential to your health. I really couldn't help myself with sleeping animal pictures, so bear with me, I guess. Like we talked about during the video on exercise, having an impact on all 11 body systems, sleep also impacts each of these 11 body systems. Sleep benefits the circulatory system by healing and repairing the blood vessels of the heart and other areas of the body needing repair. A person's blood sugar, blood pressure, and inflammation levels are healthier with adequate sleep, and a lack of sleep can increase a person's blood pressure and subsequent risk for heart attack or a stroke. The digestive system is related to sleep by two hormones that are in balance with adequate sleep that stimulates you to be hungry and another that tells you you are full or have had enough to eat. Have you ever noticed that you get the munchies when you're tired? It has to do with these two hormones being out of balance and your brain having an impaired decision-making ability as well as impulse control issues for you to reach for foods that are higher in calories with sugar, salt, and fat. You also have less energy levels, so it makes it harder to be motivated to exercise. Being fatigued also can cause your body to release higher amounts of insulin, and from what we spoke about in the nutrition video, we don't want to have insulin as that so much more insulin as that can lead to your body storing your calories as fat and increases your risk for type 2 diabetes. The endocrine system, which is your hormones, has a complex relationship with sleep. Growth hormone is released when you are sleeping. Growth hormones helps you to build muscles, so it isn't just when you're a child or a teen that this hormone is important. A lack of sleep messes with the balance of your hormones, when normally some hormones increase at night and others are suppressed. Adults who sleep 5 or few hours per night are 2.5 times more likely to have type 2 diabetes. Remember how the digestive system secretes more insulin when you are sleep deprived. The immune function is suppressed when you do not get enough sleep. Proteins called cytokines are normally released during sleep that help with inflammation and fighting infections. So when you are not getting enough of sleep, you have a better chance of getting sick and staying sick longer. The dermatological system is your skin. It's affected by sleep by having accelerated aging if you do not get adequate sleep. This can include fine lines, uneven skin pigmentation, and reduced elasticity, as well as not recovering as quickly from sunburns or other toxins your skin may come in contact with. The muscular system needs sleep as a time to be stimulated for muscles to replace, repair, and rebuild. Like I said, growth hormone is released at the beginning of the deep sleep cycle. Let's see, the nervous system needs sleep to rest from concentrating, learning for your memory, and to restore your mood. Helps you with making decisions and to have creativity if you're better rested. Sleep deprivation is strongly correlated with anxiety, depression, substance abuse, and suicide attempts. With sleep deprivation, you can think your function is better than it actually is. Sleep deprivation can leave you as impaired as alcohol intoxication, so it's a bad idea to drive. Even a 20 to 30 minute nap before you drive can be helpful to take before driving to make you a safer driver. This is a long slide, so I'm sorry. The reproductive system is connected with sleep, with infertility, a decreased desire for sex, less testosterone in men, and interferes with a woman's capacity for reproduction if there is sleep deprivation. The opposite is true if a person is getting restorative sleep. The respiratory system becomes more vulnerable to respiratory infections like the cold or flu viruses when there is sleep deprivation. There is commonly more snoring, less quality sleep, and sleep apnea that interrupt sleep in people who are not getting the restorative sleep that they need. The skeletal system needs sleep for bone health. When you sleep is when your body is breaking down or repairing your bones. A lack of sleep disrupts the process of bone remodeling and can decrease your bone density and aging and skeletal development for younger people. Finally, your renal or urinary system is impacted by sleep as you produce more urine during your waking hours and less urine during the night. When your sleep and wake hours get confused, you may produce more urine when you're asleep and have to get up more often to use the bathroom in the night, which can further interrupt your sleep. This can also cause bladder control issues as well. All right, we talked about why restorative sleep is essential to your health. Let's talk about what restorative sleep is. Restoration means a renewal of health, strength, and well-being. And the definition of sleep is a rapidly reversible state of immobility with greatly reduced sensory responsiveness. Sleep is rapidly reversible, unlike a coma or hibernation. A noise, shaking, or natural waking time are needed to wake a person up. Humans have a preferred posture and place for sleep, so it's a little bit harder to sleep on the airplane. You'd rather be in your bed. So let's talk about the different stages in your sleep cycle. Each of them is important. If you get interrupted a lot in the night, you're not going to get into the deeper stages. The first stage is the onset of sleep. It's when people transition from wakefulness to sleep. It typically lasts between 1 and 7 minutes. The depth of sleep is light and people are easy to arouse in this stage. A person's eyes fight to stay open. Muscle twitching might be observed. The second stage lasts about 20 minutes. Over the course of the night, humans spend approximately 40 to 50% of their time sleeping in this second stage. During this phase, the frequency of brain waves becomes slower, respiration and heart rate are slower, and the body temperature tends to go down. The third stage is known as the slow wave sleep and delta sleep. It is the beginning of deep sleep. During this period, the brain begins to produce high amplitude slow waves. The large delta waves are seen as they measure them. Blood pressure falls, breathing slows, and then REM sleep is rapid eye movement. Individuals enter this stage about 90 minutes after they initially fall asleep. During this phase of sleep, which occurs in increasing long episodes across the night for a total of an hour and a half to 2 hours, the brain becomes more active. This stage is notable for rapid eye movements, that's why it's called REM, and these are associated with dreaming. The eyes may move quickly in different directions, heart rate and blood pressure increase, breathing becomes faster, irregular, and shallow. This stage is when the brain consolidates and processes what it learned from the day before so it can be stored in a person's long-term memory. So obviously, if you're not getting to that REM sleep, that not only you're not going to get the physical benefits of sleep, but you're not going to be able to get some of the things that you've learned from the day before stored into your long-term memory. Let's talk about your circadian rhythm. Your circadian rhythm is your sleep-wake cycle in a 24-hour period. Most adults are awake for 16 hours and sleeping 8 hours. Let's start at 6 a.m. sunrise at the top of the circle of this image. Your blood pressure increases, preparing you to get up when you wake up in the morning, as well as stimulation to your brain that includes your frontal lobe for your mind to be alert. Sunlight stimulates something that suppresses melatonin to promote wakefulness. 8:30 a.m. to 9 p.m., melatonin rises with the onset of darkness. 10:30 p.m. to 6 a.m. is something that rises during the hours you're awake is a chemical in the brain called adenosine. It is a byproduct of the energy you use, and it accumulates and it signals your need for sleep. So something to note is that caffeine and adenosine affect your circadian rhythm. If you take too long of a nap in the afternoon, it lessens your level of adenosine, and that's why it's hard for you to go to sleep later. And also caffeine fights the same receptors of adenosine, and so obviously it's stimulating, but you just got to be really careful how much caffeine you're drinking and by when, for that it won't affect your adenosine levels closer to bedtime. You want those levels to be high so that you can go to sleep at a proper time. This slide is a good visual showing how many hours of sleep per day we need for when we are a newborn until we are an older adult. You can see that you need a ton, most of your day sleeping for the newborn and a little less as an infant. And then you get to the teen, you still need 8 to 10 hours, and young adults 7 to 9, and older adults 7 to 8. So just keep in mind these are the healthy levels for optimal functioning, and just kind of see where you fall according to your age group. So let's talk about some possible barriers to restorative sleep. Sometimes having a high blood sugar at bedtime can get in the way of your ability to fall asleep. Thyroid problems, psychological problems, and even life events like a death in the family or divorce or moving can cause you distress, anxiety, and depression. It just makes you more restless. Maybe you you have a failure to prioritize your sleep. You have an absence of a sleep routine. You're binge watching until right before you want to go to bed, and it's just so stimulating and has that blue light. Disturbances or outside or inside of the body. So it's noisy outside, the temperature is too hot, there's too much light, etc. Watching the clock while trying to fall asleep, you only have 5 or 7 hours before you have to get up, and you have a stressful day tomorrow, and you keep checking the clock, and it's just making you more stressed that you're not falling asleep. Medications such as beta blockers or antiarrhythmics for the heart, thyroid medications, steroids, diuretics, stimulants for ADHD, etc. can interfere with sleep, and that's why you normally take those in the morning. Taking daytime naps that last longer than 30 minutes, like two slides ago I told you, if you take too long of a nap too late in the afternoon, it messes with your adenosine level to not be high enough for you to have that draw for sleep, because you're going into sleep cycles if you sleep longer than 30 minutes, and so when you wake up you're groggy because you're kind of in the middle of a sleep cycle. Like, it's just better for you to go to bed early than it is for you to take really long naps during the day, because it's just going to mess with your ability to go to sleep that night. So going to bed too hungry or too full, so you want it to be like an optimal blood sugar level. You don't want it to be too high and too full and your body is just overrun with the digestion it still needs to do. You want to eat a few hours before you go to bed at least. But too hungry, it's going to wake you up because your blood sugar is too low. And like I said, catching up on sleep at odd hours of the day, keeping it shorter and going to bed earlier is the better way to do it. Consuming too much alcohol or caffeine, and I talked about how the effect with caffeine on adenosine, and then alcohol, people say that it helps them go to sleep, but it doesn't take them into the deeper levels of sleep, so you're not rested when you wake up. There are sleep disorders and also a lack of awareness of sleep-related problems, like you don't have a routine, or maybe you have sleep apnea and you have no idea. Let's talk about ways that you can achieve restorative sleep. It's so important that you establish a regular sleep-wake routine. Be consistent by adhering to it daily and as closely as possible on the weekends. I know it's tempting to stay up late and sleep in, but it really messes things up. It's good to keep your sleep-wake cycle within an hour or two. Get regular physical activity in the morning or afternoon. Daily physical activity promotes quality sleep. It makes it easier to fall asleep and wake up easier as well. It is okay to exercise in the evening, just not too close to when you're going to bed. Get daily exposure to outdoor light, and remember the exposure to early morning light is best for your circadian rhythm. Control caffeine and nicotine intake. Limit alcohol consumption. Strive to drink coffee in the morning only. Nicotine is a stimulant and best avoided entirely. Caffeine can prevent you from falling asleep, and alcohol can wake you up in the night. So people think that, they have like a nightcap or whatever they call it, and they are sort of asleep, but again, they're not in that deep, in the deeper stages of sleep where they are actually getting the benefits of restorative sleep. So both caffeine and alcohol can prevent restful sleep. Power down before bedtime. It's so important that you have sleep hygiene. You have a bedtime routine. You power down before bedtime. You can read, meditate, stretch, deep breathe, listen to a podcast, take a warm bath. Avoid bright lights or anything stimulating. Blue lights can block melatonin production and increase cortisol. Cortisol is good when you are awake and functioning in the day, but it makes it harder to relax if it's present just before bedtime. The text recommends avoiding screens an hour or two before bed, and I know that that's probably a lot easier said than done, especially during the really dark days of winter. Let's talk about things that you can do in your environment to induce and support restorative sleep. You can, instead of watching in your bedroom, watching movies, use your bedroom for sleep and sex only. Avoid watching TV or using screens in the bedroom is what the recommendations are. Use screens and do other activities in another room so you associate your bedroom with sleep and sex only. Get comfortable, decrease the temperature. A drop in your core temperature is a signal for the body to rest. Get the room as dark as possible. Get blackout drapes or an eye mask if you must sleep in the day. I've worked night shifts, and so you can use a white noise machine or app on your phone, or use earplugs if there are noises you can't control that interfere with your sleep. Let's talk about timing of eating before you go to sleep. You need to eat wisely. Eat dinner at least 2 hours before bedtime so your body has had at least those 2 hours to start metabolizing and absorbing the food. A small snack before bed is okay. Calcium-containing foods like non-fat or low-fat milk can be natural sleep aids. Tryptophan foods like dairy, nuts, seeds, bananas, honey, eggs, oatmeal, or whole grain crackers also promote sleepiness. Cherries contain a natural melatonin. You want to avoid high protein, high fat foods before bed as they are harder to digest and may keep you awake. Chamomile tea has no caffeine and may help you relax. A lavender scent is also helpful for relaxing and calming if you need some help. Keep your naps to only 20 to 30 minutes long. Shorter naps can be restorative. Take the nap in the early to mid-afternoon to not interfere with bedtime sleep. When the nap is longer than 30 minutes, you can go into deep sleep, which I've done, which can increase the length of the nap, and you wake up feeling sluggish because you're waking up in the middle of a sleep cycle. Naps do not make up for chronic sleep loss or poor quality nighttime sleep. Okay, we've made it to the end of another video about restorative sleep. In conclusion, we have some key takeaways. Restorative sleep plays a vital role to your health, as we mentioned, going through the benefits to your 11 body systems. The different stages of the sleep cycle offers your body different benefits. You get into the deep and core stages if you sleep without interruption. There are things you can do to support your circadian rhythm, like getting outdoor light early on in the day, exercising daily, and avoiding naps that are too long, too late in the day. We talked about your sleep needs by age. We talked about the barriers to sleep. Some of them you may have control over, like changing the position of your clock so you're not watching how long it's taking you to go to sleep. Others you might need to talk to your healthcare provider about if you have medications that are making it hard for you to sleep, or maybe you might need to be screened for something like having a thyroid problem. Lastly, we talked about some tips for better sleep preparations, such as having a bedtime and waking up time, being consistent with that within 1 to 2 hours on days off and the weekends. Environment factors that you can control, such as having a lower temperature in the room that you sleep in and darkness. Timing factors like eating at least 2 hours before bed and avoiding certain substances like alcohol, nicotine, and caffeine. There are things that you can eat like cherries that have a natural melatonin to help with a better night's sleep. So I hope you can see that not only is your sleep important, but there are things that you can do to help the quality of your sleep. How cute is this picture though? All right, our next steps here is for you to make a few SMART goals. Move on to video number 6, which is going to be risk of substance abuse. Thank you so much for watching, and take good care.